Dr. Mike and Kale back with another West End Wellness Wednesday video. So this video we're going to talk about the QL muscle, or the Quadratus Lumborum muscle. So that QL muscle attaches from the top of the hip, goes diagonally up and attaches to your spine and then the last rib. So what that muscle does, when it contracts, it helps lift that hip up, but it also works on tipping you off to the side and rotating back towards that side as well. These are very common to get tight, specifically people who have a tight low back. Generally, this is the main contributor to that tight low back. Why that gets tight? A lot of times, overactivation, overuse. See it a lot in golfers or people who play sports who do a lot of rotation or using that low back and hips. But also sitting all day can cause your glute muscles to get inactive, and you start overusing these QL muscles to do the work that those glutes should be doing when you're bending over, picking things up, or squatting down. So a couple of things we like to do here to help stretch those out and take some of the tension off of those QL muscles. There's one stretch here that Kale's going to demonstrate. You can do it right on the ground, super simple. You're going to sit flat, your one leg's going to stay straight, the other one's going to come in and cross. And what you do is you lean towards that straight knee, try pushing your nose down to the floor. So when he's doing this, it's stretching all the way out to that length of that muscle. So as we mentioned, that muscle goes diagonally up from that hip and across. So we're getting that full length stretch of that muscle. Other thing besides doing that is foam rolling it. So a lot of bodybuilders talk about foam rolling because it's great. What you do here, you're going to lean back onto it and you're going to tip off to the side. So 20-degree tip or so. And you're just going to roll from the top of that hip bone down to the bottom of your rib cage. So that whole length of that muscle. Do that about a minute each side, and that should help loosen it up. Obviously, a lot too, as the chiropractic office, we also look at alignment of that low back, so misalignments can irritate those nerves that go to that muscle and cause it to tighten up, but also immobility of those hips and that low back can also make that muscle overwork.